Welcome back to the third part of therapeutic massage, principles and techniques. The learning objectives are the following. Be able to know and apply the principles of massage and know your different massage techniques. With that, I want you to theoretically understand the use and effects of different massage techniques as well as the application. Looking at the principles of massage, I'm going to divide it in two parts. Firstly, the therapist and thereafter the client. So under the therapist, make sure you are able to reach all the body parts that you're going to massage. Stand in a lunge position so that you protect your own back. So stand with your one leg in front of the other one as if you're in a lunge position, and that allows your body weight to be a little bit closer to the ground so that you don't have to bend forward. When you massage, use your own body weight. Don't let your fingers and your arms do all the work. Again, assume a good body position and have a good knowledge of the technique itself. If you know how the technique should be applied, the depth, the rhythm, the speed, for how long, then you will also enjoy massage so much more and your patient will feel comfortable. Position the patient in the most comfortable and relaxed position. Your hands, remove all the jewelry, rings, bracelets, so that they don't come into contact with your client's skin. Your hands should be relaxed, not very firm hands. Also not sweaty hands, so be sure to wash them and dry them thoroughly before you start. And definitely short nails. You can't massage with long nails. When you now start massaging and making contact, maintain a firm contact at all times. So mold your hands to the parts being treated. For instance, the massaging on the lower back, your hands will be in a different shape than massaging their hand or the calf region, for example. Always avoid pinching and pulling on the patient's hair and on the limb because that will just be uncomfortable. Now we look at the principles when it comes to the patient. Patient privacy should always be respected. Consent should be asked prior to starting a massage. The patient should be well supported and always comfortable. Areas that are treated must be adequately exposed. That means if you are treating the lower back, you need to ask permission to pull down their pants a few centimeters so that you can reach. It doesn't help that you try and massage under the trousers or under the elastic, and that will also just make their clothes full of oil. So ask permission and then tell them, I'm just going to put a towel to protect your clothes from the oil, and I will just pull it down slightly. Is that okay? Cover all other areas that you won't be massaging, especially in the winter time, to keep it nice and to keep the rest of the body nice and warm. Check skin for contraindications and always ask for contraindications prior. Use a medium like an oil, a bit of powder, but normally we use oil to reduce friction and make your hands glide easier as you massage. Soap and oil in combination is often used after a plaster of Paris has been removed. Because of the skin not being exposed to the sun, the skin is often flaky and dry, and then when you use a combination of soap in your hands with some oil and rub that into the skin, then often the skin, that dry skin, just peels off. That's marvelous. Maintain contact with the patient's skin. Okay, so don't put your hands on the skin and then suddenly it's off again. Just maintain the contact as you do your techniques. Should not be painful. Be aware of the state of the tissue under your hands. So as you are massaging, you should actually observe with your hands and thinking, but what am I feeling? Am I now working over a tight area or an area where there's a muscle spasm, a trigger point perhaps? So always be aware of what's going on underneath your hands. So where the nerves run, the superficial nerves, and on bony prominences, if you keep massaging over those areas, it is not comfortable. So try and avoid that. Always have a relaxed treatment environment. Always have a clean space as well. Make sure your plinth is thoroughly sanitized, especially the area where your face goes in, and that you have a clean towel for their heads to rest on, as well as a piece of paper especially for the ladies with their base on and their makeup. So you always want to have the towel and then a separate piece of paper for them to put their face on. And always do a thorough assessment before you commence your massage. What are the different massage techniques? First, we're going to look at stroking gliding, it's the same thing, and effleurage, so the more softer relaxation techniques of massage. Thereafter, we're going to look at petrissage and the different petrissage techniques. And finally, tapotement percussion techniques. Different name, but the same technique. The massage technique that you will decide to use, or a combination of them in the same massage for one client, may need to be modified depending on the area. So you can basically use all 3 different groups of techniques as are highlighted in red and that I told you and that we mentioned in the previous slide on any area on the body. But because a calf is different to a neck, it has to be modified. You may also need to vary the technique due to the patient condition. Not everything can be done exactly the same for every patient. You will have to use your discretion. Stroking or gliding. What is this technique about? It's a very superficial gliding movement that can be performed in any direction on the surface of the body and on the skin. It is superficial and the speed may vary, but your hands should move smoothly, lifting only at the end of the stroke. So this is like an introductory stroke, also to make the patient get comfortable with your touch. So the effects of stroking and gliding are the following. It depends on how you perform it. If you do it faster, briskly, it will stimulate superficial nerves and cause a vasodilation. If it's performed more slowly and monotonously, it may cause a sedation of the superficial nerves, which gives you a more calming effect. which you will use for somebody that's under a lot of pressure and a bit stressed. Deep stroking may cause dilatation of arterioles on an area with arterial supply deficiency. And stroking and gliding can also be used as an alternative to hacking if it's performed briskly at the end of the massage. We will look at these in our practical session. The uses of stroking and gliding massage technique. So it can reduce muscle spasm and pain after trauma. It can also be used in cases of neuralgia. That's that very sensitive, painful condition that patients at times present with. For people that don't sleep well, they have insomnia, this type of massage on their face, neck and back is a really good tool for them and may help them to calm down and hopefully sleep better. It's also useful when you want to apply your massage medium, meaning the oil that you are using. Like we said before, that first touch, when you put your hand on the patient, it habituates the patient to your touch. Another use is to facilitate progression of sensory analgesia, so to relieve pain, and to decrease muscle tone when you do slow stroking massage. Effleurage is a stroking movement, and it always follows the superficial venous and lymphatic drainage back to the heart. And effleurage, a French word, actually means to skim over. So it's where when you do superficial effleurage, where you work very superficially on the skin itself. And it's as if you skim over the skin. Uses and effects of effleurage are the following. It assists with lymphatic drainage and venous drainage as well, by your hands causing a mechanical pressure. Indirectly, it increases the arterial blood flow to the skin, as you can often see the pink while you are massaging as a result of your hands and the massage. It has a sedative effect if done slowly. When you do it briskly, it has a stimulating effect. It can also, when you do a deeper effleurage, cause the subcutaneous soft tissue to stretch, and it aids in interchange of tissue fluids. Some more uses and effects of effleurage. It stimulates lymph flow and thus aids in the removal of chemical irritants. As we said, can give a passive stretch to muscles. It may also increase the muscle tone if it's done a bit deeper, and decrease the muscle tone if it's done more superficial and light. It improves the blood flow in the superficial veins. It can also increase this mobility of soft tissue. It has a hyperemia effect. That means the blood flow increases as the blood vessels dilate. It's also used as an introductory massage and manipulation to accustom the patients to your hands. Definitely a relaxation technique and preparatory technique for other massage techniques as your deeper petrissage techniques. Inform the therapist of factors like muscle tension, the temperature of the skin, and the texture. So when you do your effleurage, look out for what you feel under your hands. Effleurage is often that technique that comes between different various various massage techniques. So it's almost as if you can maintain continuity when you go from stroking, then effleurage, then your deeper petrissage techniques. So effleurage can always just introduce a new technique. It aids drainage of areas with edema. Like we said, it has a sedative effect, and especially when the patient had a traumatic incident, and also to stretch contracting subcutaneous tissues. So what are the contraindications for using effleurage? When the patient is very hypersensitivity in their body, when there's gross edema, where you don't want to, where you can see the skin is very almost shiny and thin, and you know that there's a danger of damaging the skin, a new wound, as it can cause further hemorrhage, unstable scars that you can open up again. You will be able to see this when you assess the scar. Flaccid paralysis, especially if the muscles are superficial and could be stretched, or spastic paralysis, because tone and spasm would then be increased. Now looking at petrissage techniques, our next type of massage technique. So you get 4 different types under the main heading of petrissage. Petter meaning to knead. So the 4 different types are kneading, wringing, picking up, rolling. What are the general effects of these techniques? Let's go through them. Assist in venous and lymphatic drainage. It aids in tissue fluid interchange. It increases the mobility and length of fibrous tissue as we now work deeper. It's a deeper massage technique. It also restores the mobility between tissue interfaces, leads to dilation of blood vessels if done more vigorously, and can also lead to relaxation if you do it more slowly and rhythmically. Some people, especially your sporting population, they actually find it very relaxing to do deeper techniques when they get a massage. It increases muscle tone if you do it more briskly. So it has to do with the rhythm, the speed, and then you can have different effects with your massage. Some more general effects. We've seen that it mobilizes fibrous tissue as well as skin, provokes a somatovisceral reflex effect. By alternating compression and relaxation of the muscle, the venous return is mechanically assisted, and it helps to get rid of waste products and then replenish the nutrients that can now flow back into the area by that increased blood flow. By doing petrissage, you can prevent or even loosen, treat adhesions in muscle and muscle interfaces. Muscle interface is where the muscle lies closely to the connective tissue and to other areas like the next muscle or nerve running through it as well. Promotes healing, and it improves the condition of your skin, especially when you use oil and soap massage after a plaster of Paris has been removed, that's been applied for a fracture. What are the contraindications when you don't want to use petrissage? For a very recent injury, where pressure can actually cause more the injury to worsen, or pain can be increased, a new wound as it can bleed, scars that are not ready for massage, that haven't healed up completely, as you can open it, and that we don't want. There's a venous thrombosis because of an embolus. That's dangerous, as the clot can be dislodged. Sepsis, because it can spread. And flaccid paralysis, because of the muscle fibers perhaps being bruised. This is, for instance, in somebody that had a stroke. We now look at the different types of petrissage. Firstly, kneading. The muscles in the subcutaneous tissue are alternately pressed inward and upward. Take, for instance, your calf muscle. When you massage it, you hold the muscle, the gastrocnemius muscle, or the soleus muscle, the calf complex, with a lumbrical grip. That is where you move your fingers, your index and your up to your little finger. You flex your metacarpal joints. I'll show you this in the practical session. And you bring your thumb towards it. So you grasp the tissue like that, and you press inwards and upwards in a kneading fashion. They are squeezed, compressed, released in a rhythmical manner. Your hands should mold to the area. A modification is small areas treated with the tips of your fingers and thumbs. Reinforce kneading, one hand placed over the other to increase the depth, especially in the back or the gluteal areas. Picking up. Here, you may want to use both hands or one hand, depending on how large the area is that you are treating. Muscles are grasped, lifted, squeezed, and released. So you actually pick up that muscle. During the lift, the palms must not lose contact with your skin. So maintain contact. The squeeze must always be done in the distribution of the venous and lymphatic flow. So from distal like your foot position, to proximal, where your head is. So it should be done in that direction. Ringing. It's used when you want to stretch the tissues. The muscles and the subcutaneous tissues and the skin are grasped with both hands using that lumbrical grip that I told you about. Google it if you're not sure what the lumbrical grip looks like. And then the tissues are lifted. So as you lift the tissues with both hands, then the hands move alternately backwards and forwards along the axis of the muscle. So that means you hold the tissue with your lumbrical grip. Try it on one of your family members or a friend. Lift it up. Then the one hand moves forward while the other hand moves back. And then you swap. And in that way you will see that you are ringing the tissue, and it stretches the tissue. The rolling petrissage technique, often referred to as skin rolling. I use skin rolling more than I do muscle rolling. Here you also use both hands. The hands lie flat on the surface. Try it on somebody's back. The skin and the subcutaneous tissue are then grasped between your fingers and your thumb, forming a fold. It's almost like you are picking up somebody's fold along their belly, but now only on their back. So try pick up that skin, and then the tissues are rolled forward. So if you are picking it up, your fingernails are facing away from you. You are looking at your thumbnails. Then move that skin roll, but keep that skin roll going as you move from the bottom of the back to the top. You can also then reverse and do it backwards. Now we move to our third massage technique called tapotement or percussion manipulation. So what does tapoter mean? It means to tap. So we also have different types of tapotement massage techniques. The first one, hacking. So how do you perform hacking? So you turn your hands, both hands, with your thumbs up. The pinky part is facing down towards your patient, as it is performed with the ulnar border of your hands. So the ulnar borders are where your ulnar is, the ulnar bone in your forearm. So the ulnar borders, that's what you will use for this techniques. The wrist is kept in extension, meaning slightly back, and there is a pronation and a supination of the forearms. The shoulders are slightly abducted away from your body and the fingers are relaxed. And then alternate movements with your hands, you are then moving your one hand down onto the back, try it on somebody's back or somebody's calf, and then the next one. So you hack that muscle and then you move along the entire length of that muscle. More tapotement techniques: clapping, vibration, beating, pounding, and tapping. Let's go through them one by one. Clapping. It's where you manipulate the area that you are working on with the whole palmar aspect of the hand to strike the body part. So it's almost like you are clapping somebody, but not them. Of course, the muscle, using the palm of your hand. What is vibration? It involves a movement in which the tissues are pressed and then you vibrate your hands and then it's released up and down again. So you vibrate. Beating, less used. Hand is made smaller, but it's used as in clapping, but not with the entire palmar aspect of your hand, but a little bit smaller. What's pounding? Also less used, but it is a form of hacking done with loosely clenched fists. So you don't make a tight fist, just a loosely clenched fist, and then look at your nails, and then move your one hand down where you see your knuckles. So move your hand down on somebody's calf, and then the other hand. So you look at your fingernails and then you turn your hand around, the one that's doing the pounding, so that you see the knuckles, and then you lift it up back again so you see the nails. Then the next hand's turn and pound. Try that a bit. We'll do it practically as well. Tapping, performed with the tips of your finger pads. It's almost like you are tapping the area just with the tips, just underneath your fingernails. So that's why you need short fingernails, right? And then you do your tapping, very small areas such as the face. You can use this in. Now that we are done with the 3 different massage techniques, let's look in general how you can modify a technique. So you can modify a technique with how deep you use it, the depth. Like you can be very superficial on the skin, or you can do a deeper massage where you actually want to use it to remove or treat adhesions, and you want to mobilize the deeper tissue layers. So depth, and then also you can change up your speed, the speed at which you are massaging. Faster when you want to stimulate the area, like in preparation, like a tapotement technique where you want to prepare the athlete or you'll see it in boxers as well, where they tap their shoulder muscles and then their arm muscles, and then they move to the leg, and then they tap their one leg and the next one, and then they clap, and then they beat, and so that's often at a fast speed. So that's a nice example is in sport. You won't see them do a very slow effleurage just before a big fight or a match. So when you do it faster, you stimulate, you increase the blood flow to the area. Where if you do it slower, you are causing a more relaxed sensation. For somebody with muscle spasm, you want to work effectively but slow, as you don't want to stimulate that muscle spasm to spasm up even more. Looking at the oil and the soap that you can use, this is now, normally we use oil. Remember to not use too much oil because it's difficult to get rid of the oil. You don't want to rub it off on a beautiful clean white towel. So you can always add a bit more. So don't throw the oil on the patient's skin. Put it in your hands, warm it up, and then you apply the oil or the lotion. But after a fracture has been immobilized in a plaster of Paris, the skin hasn't got the necessary sunlight, circulation has been compromised, and so that you can use an oil and soap massage as a contact medium. You may want to support the limb in elevation if there's swelling as well, and then you can do your massage in that manner. Edema massage. Make sure that you watch the next 4 PowerPoint presentations that I'm going to add for you, because there's different types of edema and you can't treat them and massage them the same way. It's done for localized and not generalized edema. So if there's a systemic reason for the edema, like a heart failure, then our massage is not going to work. So please spend time listening, taking notes on edema, different types of edema, and how physiotherapy can help the various different types, and the tools that you can use in the management. Localized edema may be due to an inflammation, a venous obstruction, or after surgery. Kneading and effleurage are used, but the kneading is often, you want to knead, but kneading in lymphedema is not indicated. There you will use more of your effleurage. Proximal areas are relaxed first in order to facilitate drainage to the heart. So your effleurage should be done from distal to proximally, but where the lymph nodes itself are obstructed, there you actually have to stimulate the lymph nodes by doing a circular massage on the lymph node, then clear the proximal area first. If in, like a person with elephantitis, stage 3-4 of lymphedema, if you're going to immediately start working from distal to proximally, you're only going to block the lymphatic drainage system, including the nodes, even more. So that's the reason why it's important for you to know what you are dealing with. The part should be elevated above the heart. Okay, it's also important for you when you do your massage, edema massage, it should be higher than the heart. So support the limb on pillows. Circulation exercises as well as breathing exercises must be given after the treatment. So now looking at scar massage. A recently healed scar, you can massage along the borders, not on the scar itself, along the borders in circular or J-stroke movements towards the scar to improve circulation, promote healing, and keep the scar mobile. So that you can do, but remember, assess the scar. The technique that you're going to use is your finger or two fingers, one index finger or two index and middle finger, or thumb kneading. Kneading, so you're going to work in rhythmical circular motions around the entire scar. You can also, when the scar heals, you can do gentle lifting, picking up of that scar. Stretching exercises must be given after the treatment. So let's say you have a scar on your quadricep muscle. Then you can stretch that muscle by flexing your knee. Almost like the soccer players or the rugby players stretches their knee. But gently, to not cause injury, but it will definitely help your treatment. A well-healed scar. You're going to use your massage to improve circulation and mobilize the scar, as you want to then break down the adhesions. So as the scar heals more, as the weeks, days go by, then your depth of your scar massage will increase. Technique here, you can also use your finger and thumb kneading. Now you can move onto the scar. You can lift the scar as well with your kneading techniques. So what techniques would you use for stiff foot and hand? If there's edema, you first want to treat the edema, place the limb in elevation, do your edema management. You can also do metatarsal, metacarpal gliding. Remember, metatarsals are the bones of the foot. Metacarpals, the bones, that long bones, and also form part of your knuckles in the hand. You can also use the arches of the foot, as well as move your thumbs into the palmous surface of the hand. Thumb kneading is very good here. You can do distraction of the joints, so you can distract the toe or the finger. Metatarsophalangeal or metacarpophalangeal joints and interphalangeal joints can also be massaged in circular motion. Remember, when there's a stiff hand or foot, that your massage is not the only thing that they need. They actually need active exercises for them to do at home, and then also stretches for them that they can do at home. So that brings us to the end of the three-part therapeutic massage theory, and I try to add some practical aspects by giving you the words of how you should move your hands, but we will do all of this in our practical sessions. The body regions that we will massage will be the upper limb, arm and hand, the lower limb, leg and foot, the neck area, the back, meaning the upper, lower and entire back, abdominal and face areas.